Good morning, good afternoon, and good evening, everyone, wherever in the world you may be joining us from today. My name is Francesco Del Carpio, and I am the CFA York Operations Coordinator. I would like to officially open the third session of the Student Nurses Voices Speaker Series, which is being presented in partnership with the Nightingale Initiative for Global Health and sponsored by the Integrative Nurse Coach Academy, the Global Academy of Holistic Nursing, and the Commonwealth Nurses and Midwives Foundation. This third session features student nurses from the region of Africa. I would like to begin today with a land acknowledgement. We acknowledge and recognize that many Indigenous nations have long-standing relationships with the territory upon which our campuses are located that precede the establishment of York University. The area is known as Toronto and has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. The territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As this is an online event, our participants may be joining from various locations, so I strongly encourage you to learn about the traditional land upon which you are located. With this, I welcome our moderators, our speakers, and our participants from around the world. It is now my pleasure to introduce our moderators, Dr. Deva Marie Beck, Dr. Maria Teresa Panizales, who are both from the Nightingale Initiative for Global Health, as well as Dr. Perpetual Ofori-Ampofo. Thank you very much to all of you for moderating today's session and for all of your work in helping put together this series and this session. For the sake of time, I will be putting the full bios of all of today's speakers and our moderators in the chat for the audience to reference. I now pass the floor over to you, our moderators. Thank you so much.
Thank you so much, Francesco. We continue to be so appreciative of what the UNITAR and the Stifel York Center at York University in Toronto, and you in particular, for everything you do. You are doing in kinding and pro bono to support nurses, student nurses from across the world, and specifically these nurses, student nurses from Africa. It is my pleasure to be introducing my dear colleague and friend, Dr. Maria Teresa Panizales, who will be opening with the poem that she shares for us to help us to center and be appreciative of this session. Tess.
Thank you so much, Diva, and welcome to all of you as we ponder on this poetry that was shared during the call conference in Switzerland.
Sorry, are you able to see my screen being shared?
I can see the first one, so we can go to the next slide. Thank you so much, Francesca. The healers. It hurts to see the suffering, our patients, our communities, our world. To be a witness where care cannot be reached, where care cannot be given, where care is a high price to pay. To hold the hands when life slips, when the newborn drifts, when honor and values are robbed, when our own identity is such that is left unknown. The humanness of being a nurse is more than what is visible. It is what is within. One who longs for a just world, for peace in the midst of suffering, or the moment of fleeting joy. One who dares to fight to hold hands with you, with everyone, as we too are your partners. We too are part of that circle. We too are healers. In building a better world.
Thank you so much, Tess. Thank you so very much. We'll be hearing from you later during our impromptu Q&A. And now it is my deep pleasure to be introducing a dear friend and collaborator, Perpetual, Perpetual.
Ofori-Ampofo.
Every time, even though I practice. Perpetual, welcome. Perpetual will be introducing all of our African professors, and the professors will be introducing their students. Over to you, Perpetual. So grateful you're here.
Thank you so much, Diva. And should I say good morning, good afternoon, good evening to you all, wherever you are joining from, but it's evening in Ghana. And it is my singular pleasure to be on this Student Nurses Speaker Series to moderate this session. And I want to say a big thank you to the Nightingale Initiative for Global Health, and of course, all the partners for this opportunity. So my role here is to talk a bit about myself. I don't want to dwell too much on that. I'm the president of the Ghana Registered Nurses and Midwives Association. I'm a foundation fellow of the Ghana College of Nurses and Midwives, and I'm also a fellow of the West African College of Nurses and Midwives and a scholar of the Global Nursing Leadership Institute. And I'm happy that, of course, GRNMA, that's the Ghana Registered Nurses and Midwives Association, continues to work with the NIGH Institute and to be part of this Student Nurses Speaker Series as well. And it's time for Africa. And we are proud that it's our turn to engage in this discussions. So I want to use the opportunity to now welcome Dr. Eunice Ndirangu-Mugo. And just a bit about her. She is the Dean of the Aga Khan University School of Nursing and Midwifery of East Africa and serves as the chair of the Nursing Council of Kenya. And it's her turn to speak, and therefore I'll hand over the floor to her. That is if she's finally joined the call.
Thank you very much, Francesca. I am here. I have joined the call. Thank you for the amazing introduction, and I'll go straight to the point. Hello, everyone. It is indeed such an amazing honor to be part of this session of the Student Voices from Africa, which is part of the very impactful Student Nurses Voices Speaker Series. And I really, honestly, truly wish to extend my gratitude to the Nightingale Initiative for Global Health for spearheading this remarkable initiative and platform, and for inviting myself and my team, that's the Aga Khan University School of Nursing and Midwifery, to be part of this session. As a start off, I want to say this, because I always find this very profound in my life. When My daughter was 6 years old. It was in the middle of the COVID pandemic, and there was no schooling happening, and they had these online sessions that were geared to building the entire person. And she was attending a session that was called Leaders for Tomorrow. And one day I asked her, what have you learned from that session? And she said, I have learned that I can be a leader, and have never forgotten that. So I'm just saying thank you very much, and acknowledging that at the heart of this initiative is a testament of the collaborative power of collaboration that exists, but also the vital role that exists in building leadership, especially among students, nurses, and building their national view and global view about what the public image looks like and the value that they have for what nurse leaders can really stand for. And I strongly believe by building student nurses across the WHO regions that are involved in this initiative, and maybe even beyond, it not only amplifies the uniqueness that exists, but also nurtures the next generation that exists for leaders, researchers, educators, and practitioners. Now, if I look at myself, I'll talk about the Aga Khan University, and I'll just say the following. The Aga Khan University School of Nursing is at the center of building and nurturing nurses and midwives for the future. And we are deeply committed to fostering excellence in nursing education, practice, and leadership. And I'm really honored to have two of my current students on the call, and I'm sure their stories and voices will amplify what it is that the university stands for. We are keen on transforming leaders, but also on the initiatives and innovation that exist within themselves and the region for them to do what they need to do. The African region finds itself in a paradox. We have amazing strengths, and we also have challenges, but I also believe that the strength supersedes the challenges. Of course, our opportunities are great and they're significant. We have a rich culture, we have a strong sense of community, but we also have a very rich, untapped, and dare I say virgin environment of things that we can draw on. But although we have the challenges that involve around lack of resources, perhaps the issues around infrastructure for healthcare that really needs to develop, we still have a huge sense of commitment around healthcare and communities. And among our students, we have seen that. We have seen a deep-rooted sense of commitment, motivation, and passion to improve and change the welfare of their communities and their people. And we've also seen students and our alumni do amazing things around innovation in terms of how they can improve and change the welfare of their population as well as the communities. Allow me to communicate around the significant role that students play in the nursing profession, and especially the future for the profession. Drawing back on the lesson I shared about my own students. It is through innovations of series such as this that we can build on a vibrant community of students and nurse thought leaders, and individuals who will not only communicate to just commit to the profession, but also will commit to transforming the public image and the voice of the nurses. This is vital because strong nursing voices is integral to shaping the policies, advancing research, and improving healthcare delivery. Every time I sit in a policy table, I always remind the policymakers, you cannot talk about SDGs, you cannot talk about universal health coverage if nursing and nurses are not central to that conversation. And that conversation does not begin with the graduate nurses. It begins with our students. Today's session aligns with the Nightingale Declaration to achieve healthy world, a global strategy that inspires commitment to improving health outcomes while fostering grassroots to global collaboration. And I think the key word today is global collaboration. All the emails I got from Dave talked about collaboration, and I think this is a proper engagement and a proper testament to that global collaboration. Encourage all the attendees today to really actively participate, share your insights, take advantage of the resources that are available, but it should not start and stop there. This is just the beginning of the next journey. Please continue to collaborate, continue to innovate, continue to engage with those people you shall engage with today and in the future. In closing, I want to underscore that I am really, really proud of the students who are represented here today and those who've made time to attend to this series and those who will attend to future series, and your stories, successes, and even challenges, in addition to your best practices, will really, honestly, truly shape the future of the nursing profession and of the healthcare system today, whether it is in your own country or globally. Please feel encouraged. Please feel committed, inspired to share. And also remember, it doesn't matter what works or does not work. In every engagement, somebody learns something from it. Allow me to end by giving the example of COVID-19, especially when I'm talking about the context of those countries that are considered LMIC. During the COVID pandemic, we expected that the African context will really struggle. We struggle with resources for water. We struggle with innovations that are available. But what did we see? We saw the true spirit of innovation that exists. I like to remember the many people who came up with a manual stepstone, watering system where you could wash your hands. All that, to me, represents the true essence that exists where the nursing profession is concerned and nursing students are concerned, and a huge challenge for us to be very innovative, creative, and not to use the challenges that exist, for instance, those related to limited resources, as an impediment to what we can and cannot do, to be thought leaders, to be future leaders, and to be innovators and world change makers. Thank you very much. I submit. And once again, thank you for the opportunity.
Thank you so much, Dr. Eunice Mugo, for that introductory remarks. That was really wonderful. We really, really appreciate all that you have shared. The importance of student nurses in everything that we do, the opportunities that abound still amidst the challenges, the importance of global collaboration, and of course, to transform policies and improve patient outcomes starts with the student nurse, and there's no doubt about this. And of course, your advice to all the students to stay committed and focused, knowing that they are the future leaders to make the change that we want to see within the profession. Thank you so much, Dr. Eunice Mugo. We'll now move on to our next speaker, who is Dr. Phaladze. Phaladze is a professor of nursing at the University of Botswana and is the former head of nursing and director of the University of Botswana, and also the WHO Collaborating Center for Nursing and Midwifery Development. At this time, I'll hand over the floor to Dr. Phaladze to give her introductory remarks. Over to you.
Thank you so much for that generous introduction. I'm actually just thankful and grateful for being invited to this Nightingale initiative for global health with my students this evening. And just to say that as I'm currently also serving as the acting deputy dean of the faculty at the Faculty of Health Sciences at the University of Botswana, and our core business really as the university is to, and the School of Nursing, is really to train, to invest in nursing education, because these are going to be the people taking over the reins of the profession, and the commitment in engaging our students in nursing education and nursing research, and also witnessing their commitment in their education as they strive to become those leaders that we want them to be, with the emphasis on quality education, quality patient care, including patient safety. We are currently challenged in Botswana still by the HIV AIDS. We still have the prevalence at 21%, even after almost 30 decades. And these professionals have been at the forefront in trying to curb that scourge. And with the COVID-19, we also you could not overemphasize the role played by the nurses. Without the nurses, we would not even have managed to handle the pandemic and the lives it also claimed. And amidst all the workforce, the health workforce challenges, we still strive to produce the global that global competitiveness. And this evening, as you will hear from my students, they are working under difficult conditions because of the limited resources, and in their program of community health, they're actually challenged with issues of making sure that they provide care with less cost to the patients. That if we are to actually realize universal health coverage, we'll need more nurses and midwives to be trained, and we have to invest as governments. We have to invest as academic institutions to make sure that we develop that transformational leadership and innovation that is required. And now with the advent of technology, we are able, at least for me, to be able to collaborate with all of you and to be able to participate in this student nurses' voices, because technology allows us, and also in the educational platforms, we're able to leverage on technology. And I hope by having our students being part of this group, it will help for them to collaborate, and also provides an opportunity for networking, also sharing their experiences and getting feedback, so that they can improve and become better nurse leaders in future. So at this point, I'm also I would like to quickly say the University of Botswana School of Nursing, being a WH collaborating center for nursing and midwifery development, we're actually in the country responsible for the development of the human resources for health workforce at a professional level. And now that we are going to be introducing also the highest degree, which is the PhD degree in the near future, we're hoping we're going to see an increase in our research output. And at this point, I would really just like to appreciate, the Nightingale initiative for having invited us to be a part of this initiative, and also to my colleagues who are also here across the continent. It's also a good opportunity for South to South collaboration. We normally look up to the North, but with this collaboration, with this participation, we're able now to forge those links and also to foster partnerships and collaborations. I then would like just to thank everybody, and want just to be part of this discussion to learn. I'm always open to learning, because we can never learn enough. And I hope that my students will also take this opportunity as a teachable and learning moment. Over to you. Thank you.
Thank you so much, Dr. Phaladze, for those introductory remarks. It is equally your responsibility to introduce your students, that is Nelson and his colleague. So I will hand over to you to do that. But of course, the issues that you shared are very pertinent. The call for investment in transformational leadership as required, and to ensure that innovation and technology are made central in the teaching of our students is very important. And you touched on the challenges that you face as a country and the limited resources that your students have. All of these also should strengthen them and empower them to do more, so that they can change the narrative in the future. And of course, the bit about the South collaboration is also crucial. So over to you to introduce your wonderful students.
Thank you once again, for the opportunity. I'm honored to actually introduce two of my outstanding students in the community health nursing program. These are graduate students. Nelson Nelson is a registered nurse, and he's currently pursuing his master's degree in community health. He actually has some years of experience as a professional nurse, and I would not want to go into what he's going to be talking about, but I would just say, these are students who take their work seriously and are always willing to learn, and we'll be hearing from him. And Kilebogile Mokoena is also pursuing a master's degree in community health nursing. She's also a registered nurse, and these are all graduates of the University of Botswana for their Bachelor of Nursing Science, and I'm proud to present them to you this evening so that they can share their stories with the rest of the team. Thank you.
Thank you so much. So we'll hand over the floor to Mokoena.
Kilebogile, over to you. Thank you.
Thank you so. Our hosts, sponsors, moderators of this movement, and my professor, Professor Phaladze, and your colleagues, fellow students, presenters, distinguished ladies and gentlemen, let me take this time and greet you all. Like Prof has said, my name is Ndirangu-Mugo. I am a registered nurse, and I'm currently pursuing my Master of Nursing Science of Community Health with the University of Botswana School of Nursing. And today, I'm so pleased to briefly share with you my nursing journey and my aspirations. As a nurse, I only worked, I had the privilege to work in a referral institution that offer tertiary and quaternary healthcare services, where I have gained experience by initially working in surgical and medical units until currently where I am in a spinal cord rehabilitation center, where patients are rehabilitated post the spinal cord injury and transition back into the community. And throughout my career, I have learned that most cases that have been referred to for further management at these referral institutions could have been avoided if primary care was implemented effectively and timely. I also experienced that though primary care initiatives like health educations are done, the effort is not enough, and mostly they are implemented late when a healthy individual now has turned into a patient. And as students, it is required in our curriculum that we do clinical hours. And some of these hours we meet with communities, especially in the specialty that I'm pursuing, that is community health nursing, to assess their needs, to work together with them to better promote their health and well-being. And in the latest project we did last year, the community we worked with was experiencing a rise in non-communicable diseases. And as students, we were encouraged and to work with this community, and we organized a wellness day with the theme, My Health, My Responsibility, because we believe that as long as we empower the community, they will know how to take care of themselves and they will be responsible for their health. We collaborated with different health stakeholders, governments, and organizations to educate the community on non-communicable diseases, on services that they provide, they provide the service to the community. And the screening for non-communicable diseases was one of many services that were offered on that day. And I must say that this is the highlight of my journey as a student nurse, because during that day, we brought together different services to the community, which otherwise they would have not been able to access at one place in just one day. And this is what I believe primary healthcare is all about. And from that day, I knew that I want to go into primary healthcare, hence I'm studying to become a community health nurse specialist, because I strongly believe that for countries to attain universal health coverage for all, which is a Sustainable Development Goal Target 3.8, primary care needs to be strengthened. And when we are talking about universal health coverage, we are talking about where everyone is able to access full range of quality health services they need when and where they need them without any financial hardships. And it is sad because according to WHO, I quote, "The world is off track to make significant progress towards universal health coverage by 2030. Improvement to health services coverage have stagnated since 2015. And the proportion of the population that faced catastrophic levels of out-of-pocket health spending increased continuously since 2000. And this is a global pattern that is consistent across all regions and in the majority of the countries." Close quotes. I am strongly convinced that primary care will forever remain the key to universal health coverage. Governments like ours in Botswana have structures built and invested greatly in primary health care, but service delivery or implementations remains a challenge. And I believe primary care policies need to be revisited, need to be resuscitated, and implemented effectively to keep the community out of the hospital. Because in a resource-limited economy like ours, if you have more people going to the hospital, you have to spend more to care for those people. But if you can provide primary care services, they do not require much to offer to the community, unlike tertiary and quaternary services, which I believe they're expensive. And I am specializing in community health nursing with the hope to contribute towards taking primary health care to greater heights, the attainment of which Sustainable Development Goal number 3, which is being to ensure healthy lives and promote well-being for all ages, will be realized. Thank you so much for your attention, and I trust each one of us will commit and play our parts towards the attainment of universal health coverage for all. Thank you so much. Back to you, Prof.
Thank you. Should I go ahead, Prof. Ofori, and introduce Nelson?
Let's go ahead and introduce Nelson, yes.
Yeah.
And I'm not Prof, I'm just Perpetual Ofori-Ampofo. Thank you.
Okay, thank you. Nelson, this is now your turn to share a story. Was locked in. I know at times the Wi-Fi challenge, network challenges.
I'm here. Hello.
Okay, great.
Nelson. Oh, there you are.
Good evening, good morning to some. This side of the world is evening. It is such an honor and a privilege to be part of this webinar. I believe I'm going to leave this webinar enlightened and having learned quite a lot from you all. And I thank my professor, Professor Phaladze, for this opportunity, and I thank the host for accepting for inviting us. I'm grateful. My name is Mutiwedi Nelson. A registered nurse based in Gaborone, that is the capital city of Botswana. I work in Princess Marina. It's our referral hospital in Botswana. I have 12 years of experience as a professional nurse, holding a diploma in nursing and a bachelor's of nursing science from the University of Botswana. I'll be sharing my experiences and my reflections on nursing. To me, nursing is about giving patients a new sense of hope and comfort during their state of compromised health, using my skills to promote health and recovery. I'm dedicated to delivering compassionate, evidence-based care that addresses the unique needs of each patient, while also advocating for their dignity and their well-being. My journey as a nurse, I've only worked in an inpatient setting. I started working in a surgical unit and in Princess Marina Hospital as a surgical nurse, and I've realized that working in a referral hospital, you realize that it will always take you back to primary health. That it is the core of everything. You will see that if the health system can focus on primary health, some of the things that are happening or some of the referrals that are coming to the hospitals, patients becoming inpatients, will be avoided. I've worked for 5 years in the surgical department, and I worked in a unit called the Advanced Wound Care Clinic, where we see advanced cases of wounds. And as an advanced wound care nurse, we see both inpatients and outpatients. And sometimes we transition with these patients from being inpatients and to becoming outpatients. And this transition involves health education and counseling to ensure patients do not return to the hospital with regressions and complications. And having to prepare these patients for this transition to the community enables us to play a role of being educators or nurse educators to our patients. And this plays a pivotal role to me, as a student of community health nursing. It kind of gave me an insight of what the community needs from us as students and prospect student nurses or community health nurses. As a measure towards achieving universal health coverage at the Advanced Wound Care Clinic, we also have outreaches program that are aimed at expanding our service coverage to communities situated in the outskirts of the country. Sometimes we have these outreach programs which are geared towards giving back to our community, as much as we are seeing mostly patients who are referred who are already at the referral hospital. So we see patients who are also at the outskirts. We conduct community outreaches to see these patients and to provide education and also training in the outskirts for patients who are not able to, access these services. And as a student pursuing a master's degree in community health nursing, one of the gaps I have identified is that the community lacks sufficient knowledge in the care of advanced and complicated wounds. There's also lack of knowledge of the current wound care, the wound care products, besides our known, betadine solutions and Vaseline gauzes. Therefore, adding to other roles, my roles as a community health nurse, I aspire to reduce the number of wound complications through health education, training, and trainings in this area as part of my part to play in ensuring health and wellness for all the people at every stages of life, which is our sustainable development goal. I also aspire to contribute to developing sustainable health care policies and interventions that positively impact communities in Botswana and influence global health policies. Thank you very much for your attention. Over to you, Prof. Phaladze.
Thank you very much, Kilebogile and Nelson, for those presentations. I just want to highlight that some of the things they spoke about, like Kilebogile working with spinal injuries. Botswana is still a young country, and we we are challenged with issues like road traffic accidents remain a big problem. And for that, you find that young people are involved in those and, of course, other people. And it will be important to actually have nurses realize that primary healthcare at the primary healthcare level, at the primary care level, they can do what they need to do their best to avoid complications, reducing risk through health education and health promotion. And that for advanced wound care, wound care used to be treated just like, doing dressing, ordinary dressing. But we have realized that without proper education on how to take care of wounds, people have lost their limb, people have become immobile because of that. And we are also, grateful that at least we have such units now, and they also have these outreach programs. And as a country, we are actually embarking on revitalization of primary healthcare to try and strengthen the healthcare system, because these are some of the things that, given the healthcare, the health workforce, which is a challenge, and not just for Botswana, but for Africa. Actually, there's a health workforce crisis in the continent. We need to do more. And I think one of the key things at the university is to identify those gaps and deficiencies and to try and find out how to bridge those. So thank you very much for highlighting those issues, Kelebogile and Nelson. And over to you, Ofori-Ampofo. I need to pronounce your name right.
Well, thank you. Thank you so much. Sorry for struggling with that. It's okay.
It's okay.
Now, that was wonderful submissions from Nelson and Mukwena. We now move from Botswana to Ghana, my own home country, and I'm happy to present to you our first student speaker, and that is Bolanle Ayana Williams. So Bolanle is pursuing a master's in nursing administration at the CAF University in Accra, Ghana. And she quite recently also completed her Bachelor of Science in Nursing from the Valley View University. She's a youth leader and a registered nurse and a philanthropist. If you look at the history of the University Nursing and Midwifery Students Association, since its inception in 2011, she is the first female president of that association. And I'm proud to say that association of students is also affiliated to the Ghana Registered Nurses and Midwives Association as one of the student bodies that are affiliated to us. So without wasting any more time, I would want to invite Bolanle Ayana Williams to take the floor. Bolanle, you have the floor.
Hello, good evening, good morning, good afternoon, good evening. Thank you so much, Mrs. Perpetual Ofori-Ampofo, for this opportunity. I want to say thank you to our organizers for giving us this opportunity to be able to voice out, share our thoughts as well to the practice in nursing and midwifery. I would like to say all protocols duly observed. Nursing. I like to say that nursing has been the kind of thing I've looked out to since when I was a child. But it took me so many years to be able to achieve the goal of being able to professionally graduate from a school, and when it comes to nursing actually as a whole. I started small as a health assistant in the same facility where I grew from a certificate nurse. I didn't stop there because I was so inquisitive to know what actually the beauty about the whole practice. And I said, no, I need to move on to become a professional. So I went in to earn my BSc in nursing, so I have a degree now. For me, the meaning of and purpose of nursing practice is the smile and joy of seeing a patient being restored back to ease or activity of daily life. And that has always been my joy since all my life. I've spent more than 17 years in the intensive care unit of my facility where I work. And in my academic experiences as well, my strengths from the classroom down to the clinical practice has been good team playing. I've been tolerant to some extent. Punctuality is always my goal, my key, because that is what I work with. I've done that for so many years and I'm still staying hold to that. I've been assertive to the decisions I make as a nurse. I love collaborative care when it comes to nursing, and as well as I have the ability to learn faster on new skills, new ideas, and innovation that comes on board. Because these are the things that we need as nurses to be able to grow better and grow with much more experience. Little gaps that I realized as a student, when you come on the clinical practice, you find out that there have been issues with documentation, which I have little issues with. The gap here is not that we do not document, but I feel that we do not do detailed documentation. We follow the nursing process to be able to give our patient the optimum care or the quality nursing care we're looking for. So we start by doing our assessments, doing our diagnosis, planning, implementation, and all that. But anytime we document, when you are in the clinical practice, we realize that we document our implementations and the feedbacks that the patient gives to us. So when students pick up such documentation, they do not have, detailed information about what was done. Things are usually done only in the examination settings. And I felt that, no, when we come on board, we should be able to know and, put in what we have learned from the classroom to see them on the practical fields, to see how it works. So if I have to advise, I think we have to be doing more training on documentation, because we want our students to learn more things, beautiful things that they have learned from the classroom. We want them to, appreciate whatever they see in the clinical field as well. And so I think organizing seminars, trainings for our nurses and midwives would have helped. I personally desire to go into academia, and I've been dreaming to become a leadership coach and mentor. So I hope to have opportunities like just this ongoing Students' Voices seminar and many more trainings that will come our way to enhance my skills, my knowledge and ability to qualify for me to work in the academic field. Of course, I have a mentor, and this mentor has been I've been admiring her for so many years. In fact, she inspired me to have gotten to where I've gotten today, pushed me to be able to go into leadership, gave me the strength to know that it's not about age, it's not about children, it's not about family, but you can impart into your community with whatever power you have. And definitely my mentor is Mrs. Perpetual Ofori-Ampofo. I really appreciate her for all that she taught me to know that you need to carry your leadership skills anywhere you find yourself. Even when I broke down and I said, oh, I have a family, she said, no. Don't let that hold you back. And I have held strongly to that. And I really want to use this opportunity to say thank you to her at this moment. The challenges I've also observed in our healthcare as well, though they are numerous, but the few ones I want to look at, and I'm happy she's here to listen, to, send our words across for us. We have lack of resources or equipment sometimes to work with. And so we need to improvise and put things together to be able to achieve that holistic care we're looking for. We are understaffed sometimes in our facilities. Why are we understaffed? We can't explain. But you see, we burn out. Well, when we burn out, we find it difficult to be able to stay in and do the full detailed things that we need to do as nurses. We also have lack of continuing training. We do a training today. It takes long before you can get, we want a training where it will keep going and the, knowledge will keep becoming refreshed, and so many other things on board. That is the challenges I found out. That my support system is actually my family and few friends who have supported me financially and emotionally during my journey, right from school into the clinical practice. And the future is really bright. If I look at Ghana today, the Ghana we used to know when it comes to nurses and midwives, it's not the same Ghana we know today. Why am I saying that? A lot of certificate nurses have moved, they have trained, and they are now professionals in the field. And, they have become confident, competent, and we have nurses who are leading in health equity. We have nurses and midwives who are leading healthcare and leading beyond healthcare. We also see visible signs of leadership competences for advancing healthcare. Our Mother Association has also done something beautiful. I think they don't know how much we appreciate that when they ease our stress with financial support by giving us non-interest loans to curb our emergencies. Sometimes we don't know where to find our money, but they are accessible. They are always there to support us. Even some of our colleagues who have been sick, they have giving them monies that they do not return back, something to keep them going and all that. Another beautiful thing that has made me see that our future is bright, that we don't usually have professors in nursing and midwifery, but today we have a lot of them in the system, and they are really encouraging. They are seeking higher education, making them fit to where the professors kept. And finally, the system is full of passionate professors and scholars. My last word I would like to say is that the future is ours to have and to appreciate. But the beauty of our profession depends in our passion and desire to give holistic care, no matter the race, the religion, or the tribe. Thank you so much for having me, Mom. I want to say thank you for this opportunity once again. Thank you and good evening.
Thank you so much, Bolanle, and I am lost for words. I didn't know I had made so much impact on you, but I'm happy you are making it. And despite the fact that you are a woman and you have a family and all of that, it's not stopping you. I believe once you are done with your master's, you're going to grow further in terms of becoming that academic person that can make a lot of influence. At this time, I want to say a big thank you to you, and we'll move on to the next speaker, also from Ghana. So we have Ama Dufie Amankwa Mensah, who is a dedicated and ambitious final year nursing student at the prestigious University of Ghana. And she is in the School of Nursing and Midwifery. As a proud Ghanaian, Ama is committed to making a positive impact in the healthcare industry and improving the lives of individuals and communities. She is currently serving as the General Secretary of the University of Ghana Nursing and Midwifery Students Association of the University of Ghana. And at this time, I would want to hand over the floor to Ama Dufie Amankwa Mensah. Ama, it's great to have you. You have the floor.
So thank you very much. First off, I would like to say a very big thank you to the President General Nimi for giving me this opportunity. I'm so valued to be representing students and nurses in Ghana, and then to organizers as well, as my first speaker said. We thank you very much for allowing us to have a voice in this. So to me, my meaning and purpose in nursing is a key factor to which I pursue nursing. And then it's rooted in a philosophy by Virginia Henderson, which states that nursing is assisting individuals, sick or well, in the performance of activities that contributes their health or recovery that they would perform unaided if they had the necessary strength, will, or knowledge. And what motivates me most is the satisfaction of making difference in the state of health of such individuals. Now, as a student, my academic journey has provided me with a strong foundation in nursing principles and administrative management through the courses that I've undertaken so far, which includes nursing perspective, principle of nursing, just to mention a few. Also, as part of my strength, includes access to hands-on training in areas like medication administration, CPR, infection prevention, at the Stimulation Center of University of Ghana, Medical Center, and the Skills Lab within my fraternity, which has built my confidence and expertise in the provision of such care to patients. Despite all these strengths, there is gaps that exist, and these gaps include lack of um, inadequate hospital-based practice, in a sense that, one, the current educational system I see prioritizes classroom learning, leaving limited time for hospital-based practice, which is often restricted to vacation periods. So students only get to practice what they've learned during vacation periods or intra-semester, which is just 2 weeks or 3 weeks. This structure creates a gap because students like myself don't get consistent hands-on exposure during training sections. So there is also a perception of that students, due to their limited experience, may not be competent to provide safe and effective care. And this concern that in charges or the administration has about students, that okay, fine, if we allow students to do this, maybe they will put the patient safety in a negative position or something. There'll be a negative impact of them. Prevent students from practicing what they've learned. So we just go to the hospital and you'll be like, send us, like we are available, just go and buy this, and we run errands instead of doing what actually we've been taught to do. We mostly go to the hospital with objectives, but then our objectives aren't really fulfilled or really met. Now, how do we bridge this gap? Pertaining that of the limited class, limited hospital-based practice, I think we can partner with stakeholders and decision makers to update the educational system in such a way that the classroom education and then the practical education will be balanced. And also, with the restriction of students due to inexperiences, I think we can implement a supervised practice where an experienced nurse closely guide and monitor students during their interaction with patients. What I need in my nursing education now is also a gap, because I feel like when I was a novice, I didn't really know much about nursing, that there are so many specialties, you can do this, you can do that. And as a final year student, having gained much knowledge into nursing, I think I deserve it would be much better to get a career counselor who would advise me on the next step, since I want to climb really high in the academic ladder. My mentor is a senior lecturer within the adult health of my department, and it's Dr. Gladys Jancy. My support system financially is my family, while emotionally is my circle of friends. The most biggest challenge in our current healthcare system, the first presenter from Ghana has actually said one, but then in our community, through clinical experience, I've realized that there is a delay in seeking for help when it comes to the rural areas. I don't know if it's because of the notion that, oh, the sickness will just go away, let's give it a few days as risk. So the patients will come to hospital when the sickness is severe and may lose his or her life. I actually experienced a baby, no, it wasn't a baby, it was a 2-year-old boy, died from malaria. And then the history that was taken was that the mom said that the baby was sick 4 months ago, and she sorted herbal medication and stuff. And this patient, the baby lost his life just like that. Now, as a student, how do we bridge this? How do we contribute to the potential solutions to addressing these challenges? So, as a student leader, One impactful way to address the challenges of rural health is by actively participating in rural outreach programs, which we often do that with NGOs because of financial support and material resources support. And also advocating for the establishment of well-equipped healthcare facilities in rural areas is crucial so that equal health can be accessed by them. And I heard the very first presenter from Botswana talk about the universal health coverage thing, which is really, really important. Now, the National Health Students Association of Ghana has embarked on a journey to construct a well-equipped healthcare facility in one of the villages in the eastern region of Ghana. The challenge faced by them is that the source of fund. So they now have to go a long way in seeking funds, which sometimes motivates them. So we just hope that as associates, we contribute a few token to them to help them in achieving such a. The future of nursing from my perspective, I think as emerging into practice, nursing will undergo a significant modernization, which is driven by advancements in technology and evidence-based model global leadership. Nurses can model global leadership by cooperating with global policymakers and advocating for nursing involvement in shaping healthcare policies. This is my reflective and experience nursing so far as a student nurse. Thank you very much for having me and thank you for your audience.
Thank you so much, Amma Dufie Amampa Mensa, for sharing those thoughts. It's good to have nurses' voices, student nurses' voices here on this webinar. And she is a Bachelor of Science degree student, and therefore very new in the profession in terms of now going through her training. And of course, Bolanle, the first speaker from Ghana, is more experienced, having 17 years of experience working in an intensive care unit. They have both shared some of the challenges in terms of lack of resources, the delay in seeking help, especially at the lower levels of care by the population, which results in a whole lot of issues and other issues. I just want to throw a little bit of more light on what they have shared. So when it comes to the nursing profession in terms of career pathway or academic development, or professional development, we have gone very far. In terms of training at the universities, we are now running PhD programs. At the same time, a lot of our lecturers are qualifying as professors. We have the first professor in nursing in Ghana and the second across the region of Africa to now hold the vice chancellor position at one of the biggest universities in Ghana, which is the University of Health and Allied Sciences. So nursing and midwifery is growing. At the same time, and you realize that those who have gone far in the profession are mostly in academia, and that is where we need to work on. We need to get more of them to also stay at the clinical area and impact practice of our professions. And when it comes to student nurses, just like Amma shared, and it touches me a lot, that you go to have clinical experience, to practice what you have learned, and end up going on errands and not achieving the objectives of your clinical placement. And this is a big worry. And from where I sit, we'll continue to engage with stakeholders to ensure that you are given the necessary support when you are also at the clinical area. But of course, the reason they share is reasonable, that they feel you are not you don't have all the skills required to take care of the patient, and you may end up harming the patient instead of doing good. So they want to prevent that. But that calls for the need for more. We need to intensify preceptorship and mentorship in our area of practice in terms of what we do in Ghana. I know some policies have been done at the level of the Ministry of Health, and more work needs to be done in terms of its implementation. The population seeking care late is one big issue. Ghanaians are head into traditional medicine and alternative medicine as a whole. So by the time they come to the hospital seeking orthodox treatment, the conditions are far advanced and it becomes more costly and more difficult to treat. It all comes back to education, public education, and we need to intensify this to ensure that the population is well placed in making the best informed decision when it comes to their care. So for you, in terms of career counseling, I think that there are avenues available to give you that kind of support, and we'll continue to engage on that. So thank you both for those wonderful things you shared with us. We started with Botswana, we've moved to Ghana, now we move all the way down to South Africa, And we are going to hear from Dr. Mavis Mulaudzi, and she's a South African research chair in the Ubuntu Community Model in Nursing and professor of nursing at the University of Pretoria with 37 years of professional experience. She has served as head of Department of Nursing and chair of the School of Healthcare Sciences, and also serving on many national and global leadership positions. She's somebody I know. She is very versatile, and she's also a friend. I'm lucky to call her a friend. And of course, she chairs the Forum for University Nursing Deans in South Africa and the African Regional Coordinator of Sigma Theta Tau, among many other portfolios that she holds. So we are privileged to have you, Dr. Mulaudzi and Mavis Mulaudzi. And at this time, I'll hand over the floor to you.
Thank you so much, Perpetual. I think I'm the only person that will be able to pronounce your surname better. Ofori-Ampofo.
Yes, you got it right.
Yes, I knew I would be the first person to do that. Thank you so much for introducing me. And I just want to say thank you so much for giving us an opportunity to also be part of this initiative. That is really a very good initiative of nurturing our own students and giving them voices to speak, and so that we as leaders of nursing can listen to them. Tonight, I decided to have undergraduate students from the University of Pretoria. We chose these students because we know that they come from one of the distinguished universities in South Africa. The University of Pretoria started the undergraduate degree in 1956. So they were leaders in undergraduate degree. So their role now is just to be trailblazers and making sure that they equip their students with and keeping them abreast of what is happening in the profession to ensure that they develop intellectually, culturally, and most importantly, to have personal development. That's why I felt it is very important tonight to expose them to this particular seminar and initiative so that they can be able to understand that nursing is global. And we think we are not supposed to thank the COVID-19, but it really gave us an opportunity to network and also to use technology to ensure that we connect globally. So I will not waste more time. I'll just start by introducing my first student. And my first student is gonna be Ria here, who is a third-year student. She is an outstanding student, and I will not say much. You will hear from her speech. She's a dedicated student. She's committed to learning and growing in her field. She's striving to become a skilled and compassionate healthcare professional. And her journey is driven by resilience, empathy, and a desire to positively impact those around her. Ria, the stage is yours.
Thank you so much, Prof, for this opportunity. I'm really grateful, and I'm honored to share my nursing my nursing journey with everyone today. Good evening, good morning, and good day to everyone from the different time zones. The meaning of nursing for me lies in connection. It's not just about treating someone due to their symptoms, but it's seeing this patient as a whole person. It's understanding their fears, celebrating their courage, and also walking alongside these patients in their vulnerable moments. This utter connection is what fuels my purpose. It's the whispered thank yous when there's never enough words from anyone to just say how grateful they are. It's the smiles that surface through the tears and the trust that patients place in me, even though I'm still a student. My motivation to continue on this journey comes from the opportunity I have to be both a healer and an advocate, to serve as a voice for the unheard. I'm driven by the idea of each interaction that I have, whether it's a conversation, whether it's a procedure, or whether it's simply holding the patient's hand. And it's had the potential to make the most lasting difference on me from my first year. And I'm so grateful for that. Knowing that every skill that I learn, every moment that I persevere will help me advocate for better patient care and for the people that actually need it. I chose this path and this career because it challenges me intellectually, it humbles me emotionally, and it empowers me to make tangible differences in people's lives. My current academic experience has given me the privilege to learn from skilled professors and clinical instructors who are so deeply invested in their students at the University of Pretoria. And the hands-on clinical rotations have been especially transformative in strengthening my confidence and practice in clinical skills. But although all of this, there are gaps that exist. For instance, I feel sometimes we lack exposure to interdisciplinary collaboration and mental health crisis interventions. To bridge this gap, nursing programs can integrate more real-world case studies and stimulations that emphasize these areas, as well as opening nursing to new avenues that are created by modern medicine, to lessen the burden that nurses have faced by straining them out. In this journey, I've definitely learned resilience, but it's also showed me that you always need support along the line. At this stage in my entire journey, I understand that balancing self-care with the emotional toll of nursing comes with my fortunate group of people that I have as a support system, which consists of my mentor that was given to me in my first year by the University of Pretoria, my professors, my senior nurses who form my support system, as well as my peers, friends, and family members who always remind me why I started this journey. Although all of this, today healthcare faces rather large and complex challenges, which is the increasing complexity of patients in the healthcare system, struggling with inequities and resource limitations. The demand for quality care continues to grow, but healthcare systems are already far too strained by staff shortages, economic pressure, and disparities in access. Solutions to this could be expanding preventative care by strengthening communities' healthcare initiatives and focusing on prevention care and reducing hospital admissions and lessening the burden on acute care facilities. Next, I'd like to mention universal healthcare is a critical goal for achieving equitable healthcare goals globally, as well as the South African National Health Insurance System, which offers a valuable model aiming to provide equitable healthcare to all citizens. Nurses play a pivotal role in this, especially not only as caregivers, but also actively as policymakers and advocates for equitable healthcare systems. Addressing the workforce shortages, government and institutions can invest in scholarships, loan forgiveness programs, and policies that support recruitment and retention of healthcare workers, especially in underserved areas. For us, that would pertain to our rural areas, and usually these are on the outskirts of most provinces. As well as governments and other people leveraging on technology for equity. Telehealth and AI-driven solutions can bridge the gap in care, especially in the rural areas and underserved communities, ensuring that patients receive timely and effective interventions. And this can open avenues for nurses as well. The future of nursing is one of innovation, compassion, and advocacy. Nursing is the backbone of healthcare, and we must continue to lead, not just at the bedside, but at the table with the policymakers. By stepping into leadership roles, collaborating globally, and advocating for patient-centered care, nurses can model what compassionate, effective healthcare should look like. With this, I'd like to leave y'all with a small little quote. To care for others, we must care for ourselves. As a student nurse, I strive to learn deeply, reflect often, and one day to give back to the next generation of nurses. Together, we have the power to change healthcare for the patient, for the families, and for our world. Thank you.
Thank you so much, Ria. I think you said a mouthful. We really, really appreciate it. One thing that I'm proud of as a lecturer and a professor at the University of Pretoria is that our slogan is that UP, or University of Pretoria, is where the leaders are born and trained and nurtured. And indeed, you have shown that tonight by making sure that you take us through your experiences and make sure that you integrate that with the challenges, and more especially what you are envisaging to see in the future as a visionary. You talked about nurses as policymakers. You talked about universal health care. You talked about recruitment and retention of workers, and more especially the AI and telehealth, which can really relieve nurses from doing non-nursing duties that we are currently doing. Thank you so much. Wishing you the best in your career and your leadership journey.
Thank you so much, Prof.
The second student that I'm going to introduce is Ithuteng Leshabela. Ithuteng is also an undergraduate student. She is a third-year student who is very passionate and driven by commitment to compassionate care and making a meaningful difference in patients' lives. She is the eldest of the 3 siblings. She has developed resilient empathy and determination during the nursing career. So she's going to share with us also what she has experienced and what is her vision for the future, and how would she like us to continue nurturing our students to be future leaders. Over to you, Ithuteng.
Thank you, Professor Mulaudzi. Good evening and good day to some. My name is Nthabiseng, and I'm deeply grateful for this opportunity to share my nursing journey with you tonight. It is a privilege to come before you and reflect on how this path has shaped not only my career, but also my purpose in life. For me, nursing is more than just a career. It is a calling. As cliche as that may sound, it is the truth. Nursing is about so much more than just treating an illness. It's about being a source of comfort, hope, and healing during some of most life's vulnerable moments. The role of a nurse extends beyond the physical care they provide. It's about creating a sense of safety, dignity, and humanity in the face of hardship. This sense of purpose has shaped my journey in the most profound ways, even beyond the hospital settings. It inspired me to start a foundation that focuses on supporting children in South Africa. Through my nursing degree, I have come to understand that addressing health challenges often means addressing emotional and social challenges too, especially for children. My foundation is my way of giving back and ensuring that children in need have the access to care and support they deserve. This aligns closely with the Sustainable Development Goal number 3, which focuses on ensuring healthy lives and promoting well-being for people of all ages. By addressing the emotional, social, and physical health needs of children, I hope to contribute to this global effort and help create a future where no child is left behind. I wouldn't have had the confidence or the insight to start this initiative without my nursing education. It has taught me the importance of holistic care and the power of compassion, which continue to drive me in this journey. What keeps me motivated is knowing that the difference I can make, no matter how small it actually matters. Whether it's helping someone manage their pain, holding their hand during a tough moment, or just merely celebrating the small victories in recovery, these moments remind me why nursing chose me. Nursing is about being a source of strength and positivity for others, and that is a role I am honored to embrace. As a third-year nursing student, I have built strong theoretical knowledge, developed empathy, and honed time management skills. These strengths have shaped my ability to care for my patients. However, I recognize the need for more hands-on experience, particularly in complex clinical scenarios, and greater confidence in using advanced healthcare technology. Bridging these gaps requires more clinical exposure, mentorship, and continuous learning opportunities, of which I actively seek out. My support system includes my family, especially my mom, who is my #1 cheerleader. My siblings, friends, mentors, professors, and senior nurses have also been there for me, offering encouragement through late nights of studying and tough clinical shifts. Their love and belief in me are a constant source of strength. One of the biggest challenges in our healthcare system is the shortage of nurses. This issue leads to staff burnouts, longer patient wait times, and compromised quality of healthcare. We can address this by supporting aspiring nurses. We can make sure that nursing is more accessible by increasing bursaries and mentorship programs. These initiatives can inspire young people to choose nursing as a career. Healthcare facilities must prioritize better nurse-to-patient ratios and mental health support for healthcare workers. These changes can reduce burnout and improve overall job satisfaction. Projects like NGOs can fill critical gaps by addressing specific community needs. For example, they will provide resources to children who might otherwise fall through the cracks of the system, helping to reduce the long-term healthcare disparities. Another challenge that we are facing is the chronic disease burden. The increasing prevalence of chronic conditions such as diabetes, hypertension, cardiovascular diseases, mental health disorders, and also obesity is a significant challenge for healthcare systems worldwide. Promoting preventative care, strengthening primary care, empowering patients, and reducing healthcare disparities are essential for managing chronic diseases and improving public health. Preventative measures like public health campaigns, screenings, and vaccinations encourage healthier lifestyle and early detection. Strong primary care ensures early intervention and better management through care coordination and improved accessibility. Educating patients on medication adherence, nutrition, and self-monitoring empowers them to manage their own conditions effectively. Addressing disparities through equitable policies, community engagement, and resource allocation ensures everyone has access to quality care, creating a healthier and more inclusive system. Healthcare is a fundamental human right, and nurses can lead globally by advocating for fair and equitable healthcare, ensuring that no one is left behind. By collaborating across borders, we can share knowledge, research, and best practices to address global health challenges. Nurses can also inspire community action by collaborating with local organizations to address specific community needs, such as food security. Nurses can help shape a healthier, fairer world. I see a bright future for nursing, where we embrace innovation while staying true to the heart of the profession, compassion. Nurses have a unique perspective that makes us natural leaders and innovators. We are problem solvers, we are critical thinkers, and above all else, we are patient advocates. Nursing is not just a career, it is a commitment to care, comfort, and create change. Thank you.
Thank you so much, Ituteng. For those who do not know, the word Ituteng means, Kana, what does it mean?
Teach
to
yourself.
Learn, teach
Yes.
ourselves. You have taught
Yes.
us tonight, indeed.
Thank you.
We have learned so much from you, Ituteng. I just want to remind my colleagues here on the platform and those that are listening that indeed at UP, we are keeping abreast of the changes that are happening around us. If we are able to teach an undergraduate student who is already thinking of innovative ideas and being an entrepreneur and making sure that she has a foundation to care for children, it means that we are really equipping our students to be able to address the sustainable development goals. We thank you, Ituteng, for reminding us that as nurses, we are leaders, we are very innovative. Even before you complete your degree, already you have thought of being an entrepreneur and giving back to the community. We really appreciate you for that. And I also realize that you and Ria, both of you, talked about the importance of mentoring and also the importance of having bursaries and scholarship to assist others. And most importantly, you talked about self-care, because you cannot be able to nurse others if you yourself, you are not well. And I think that is also very important and take home for all of us, that as nurses and the student nurses, we need to ensure that you have the best care and self-care so that you can be able to care for others. We really appreciate you for teaching us, as your name is Ituteng. You have really taught us tonight. And colleagues, one of the things that we are struggling with in South Africa is the issue that as much as we train students and they complete, sometimes it's difficult for the government to absorb them. So they end up not having employment. That's why we are now teaching our students to be entrepreneurs, to be able to open their own businesses and show their nursing skills. But we believe that nurses are they can create everything. They are very innovative and they are leaders by nature. So tonight, as we continue to talk about the students voices. We really appreciate all these voices that are coming from Ghana, coming from Botswana, coming from Kenya and South Africa. And together, I think we can have a collective. My friend Perpetual has said that I'm having a project called Ubuntu Community Model. I am because you are because I am. And together as Africa, I think we can take nursing forward, and we look forward to the student voices again for next year. And we think that what you are learning today, you are going to introduce it to other students, and we continue to hear your voices. Thank you so much. Thanks, Perpetual.
Thank you so much, Dr. Mavis Mulaudzi, for that, and a big thanks to Ria and Etutank for also sharing their thoughts to their great voices on this webinar. So we now move from South Africa to Kenya, and I wish to introduce Dr. Isabel Campbell, who is an Associate Dean and lecturer at the Aga Khan University School of Nursing and Midwifery. And straight to you, Dr. Isabel Campbell, the floor is yours.
All right, many thanks, Perpetua, for taking us through these sessions. And also a big thank you for this invitation. And of course, the Nightingale Initiative and those who organize it, giving voices to students. So far, students have talked about the importance of strengthening primary healthcare, the importance of prevention, making sure we put preventative measures to reduce non-communicable diseases, which are becoming a very big health challenge for African continent. Importance of addressing issues within universal healthcare, which is now an important initiative, especially for low middle income countries, many of which are in Africa. And of course, make sure that we strengthen workforce shortages. So what we have done in Aga Khan in terms of making sure that we participate in contributing to ensuring access to healthcare, especially for people within the primary healthcare environment, is to introduce advanced practice nursing so that we can empower nurses to become independent and autonomous clinicians, something which has not been happening in Kenya, where we have very low ratios of doctor to patients. So there has been a lot of poor access to a clinician who can be able to do treatment that is of high quality, health management that is of high quality, and be able to refer patients up the referral track. So we hope that our advanced practice nurses will bridge that gap. We have 2 new programs, advanced practice nursing, masters in advanced practice nursing, adult health, and masters in advanced midwifery. So now I'm joined by 2 students, one from the Master of Science in Nursing, Advanced Practice Nursing program, and also a new student in nursing. She's new to nursing. She's a second-year student in the Bachelor of Science nursing program. So I'll start with Bernard Mbithi, who will be our first speaker. He is an MSc student taking advanced practice nursing program. He has over 18 years clinical experience. He is also a nurse leader and has participated as a board member in our nursing council. He is also a public health expert, and he also holds a PhD in nursing. So maybe he can explain to us why he has come to do advanced practice nursing MSc after acquiring a PhD. I think in his appreciation of how serious the gap that we have within primary health environment is. So over to you, Bernard, our first student.
So good morning, good evening. Hello, colleagues. Hello, panelists. Thank you, my Dean, Dr. Isabel Campbell. Thank you for the university for identifying me to represent it in this really high-level forum where students are able to share their knowledge and experience. As my dean has just clearly said that probably I'll say that I'm a bit unique. I've been a perpetual student for many years. As you have heard, my lives are in academics, more so in nursing. It was born by me being sick one time, suffering from malaria, referred to our river hospital, our national hospital. When I was there, I saw nurses really give you very nice care, and I also admired their uniform, I'm sorry to say. And from there, it gave me the motivation. So my career in nursing started from diploma in nursing. Then after that, I went to Aga Khan University where I pursued my Bachelor of Science in Nursing and proceeded to Masters in Public Health up to PhD. But then as I also had another higher diploma in perioperative nursing and a diploma in human resource development. And as my dean has clearly said, really many colleagues wondered why after all that, with the PhD, I had to move back to do another master's. One, and my key driver is that I've always been keen to change the lives of patients. I knew what I wanted, but I did not know how to reach there. And just to mention, my 18 years of experience working at our National River Hospital, Kenyatta National Hospital, I managed to do a lot of really nursing interventions and in terms of teaching and even clinical mentorship, which has seen many nurses both in Kenya and even outside Kenya. Those from Botswana have trained your nurses in perioperative nursing. I've also trained for Namibia. I've also trained for Tanzania. Today, if you work in any operating room in Kenya, you'll either find one of my students or a student of my student. That's an impact I'm proud of having made, especially in terms of perioperative nursing. When I was still there, again, I realized after Aga Khan University, really, which has been my mentor in terms of academics, and more so mentored me in terms of research skills, I managed to head nursing research team in Kenyatta National Hospital, a river hospital in Kenya. And today, if you go to that hospital up to today, most of the changes which are there in patient care were impacted by the researches I did with my team up to today. What does this mean? It means that nurses can be leaders in change because whatever the researches we did were being utilized by the top management from the CEO and the board of management to really impact change in terms of patient care. So to me, I feel nursing as a triangle of education, one side, the other side, the research to provide evidence-based practice and the knowledge, and then the clinical practice. And throughout my career as a nurse, I've always tried to bring in these three arms to ensure that nurses make an impact in terms of patient care. When you look at it, and as my dean has asked why that, and also which surprised many of my colleagues, why are you going back again to do masters? You have your PhD, mentored many students in terms of postgraduate and all that. I realized, as I said earlier, there was a gap in what I wanted to give, but I did not know how to reach there. We had many master's programs. I work in Jomo Kenyatta University. I'm maybe one of the departments in nursing, but still there. I found it that what I want is not there. When Aga Khan started the advanced nursing practice program, after inquiring and looking through the curriculum and all that, I realized this is what I needed. And that is why I enrolled there, because I felt I need to put an impact in patient care, looking at some of the issues I've come across in my practice, even when I take students for clinical attachment. I can give you one example. I was in an outpatient department, and then one patient came, could not talk. The relatives were saying that the tongue has filled the mouth. That is just in a local language. So when I looked at the patient, I just inquired, and they told me that the patient was vomiting. And I looked at the drug the patient was taking, and I realized that this patient had just reacted to metoclopramide, and the patient was referred through all the centers up to a level 5 facility without being given care. In fact, he was very sick. Looking around, we could not get, I managed to get Attenom-Bezexol, which is one of the drugs which can be used even as an antidote for poisoning benzodiazepines. And I crushed the drug, mixed it with some saline, and I gave the patient orally. Within 10-15 minutes, the patient was okay. And I realized really, nurses, there's some knowledge gap which is existing. And this is one thing which has really motivated me to come to this program, because here, these nurses require those skills, the advanced pharmacology skills, the advanced health assessment skills, the advanced clinical diagnostic skills, so that even in the absence of the doctor, the nurses can really be there for that patient. In Kenya, we implemented the universal health care. Looking at our level 3 and 2 healthcare facilities, most of the clinicians are not there. If we really impact nurses with the knowledge and skills through the advanced nursing practice program, then those nurses down there will be able to really care for the patient, so that really by the time the patient is being referred, this patient has received most of the care. Remember, the nurse is the first person to encounter or to come in contact with the patient. If they have these skills, even before that clinician comes, then you'll find that actually the clinician may just come there to discharge the patient, having received the requisite care from this nurse. So that is what motivated me to join this program. But as a student, I've faced several challenges as an individual, and also to the larger in terms of learning. This is a new program. So there are challenges in that there's that negative perception from some clinicians that really are nurses, you want to take our role. But we have always tried to show them that we are colleagues in healthcare. And really, we cannot exhaust the opportunities which are there in the provision of care. Again, another challenge really we have faced there, where especially students when you are going for a clinical practice, is really shortage of health care and more so mentors in terms of advanced nursing practice. So one of my aims of this program is that I also need to mentor nurses who can really be mentors in terms of advanced nursing practice. Also teaching the basic nursing, the Bachelor of Science in Nursing. I really like the clinical supervision, and I'm trying to create that critical thinking skills, which they're able to utilize locally and internationally. And even as we talk now, my university, that is where I work, has partnered with a university in Australia where we are training our nurses, Germany, so that by the time they are completing, they can even exit and go to work in other places, which has tried to create jobs for nurses, even if they are not absorbed locally. In terms of utilization of technology, I'm proud to say that my university, Aga Khan University, really put that one in place. They simulated the patient, the simulation skills are very high level, where we are able to get in touch with almost the real patient care situation even before going for clinical practice. So to talk about the menders, really, I don't have an individual mender, but I have institutional menders. One of the institutions which are really mentored me is the Aga Khan University, and that's why I went back there, knowing that even my university is offering almost a similar program, and I learn freely, but in Aga Khan I'm paying fees, but I had to incur that cost because I knew that is where I can get the requisite knowledge which I required. Another mentor which really mentored me towards my career was in my secondary school, where again I was a captain in one of the dormitories, and the school embraced student leadership, and that is actually where my skills in terms of leadership were developed. My family has also been in support. My faculties in Aga Khan University and my dean in Jomo Kenyatta University, because at this level, I have many roles. I've got a lot of leadership positions, both locally outside the workplace, and I have to keep these ones balancing with the family. Okay, I'm a father, husband, and a son, and also a community colleague. So I really have to keep on balancing all those. So we have those challenges in terms of really shortage of clinical mentors, and being a trainer, that is one gap I really need to bridge. Again, on myself, when I reflect on my life, where I am, really mine is to mentor nurses of the future. That nurse who is able to impact on patient care. And I've said through the advanced nursing practice, I know that this is going to impact on that, because personally, after graduating, I'm completing by the end of this year, I'm sure already I've started looking forward to starting that program in my institution. So, because really this is what our country needs in terms of provision for universal health care, to post those nurses down there, where, as one of the speakers said, that where really that care is not really easily accessible. Nurses can be there and they'll work. One time I was in KNH where we had a doctor's strike, and the nurses were desperate. And I said, if nurses were equipped with some of these skills like the advanced nursing practice, they will be able to take care of those patients even without any major issue. For the future of nursing, really, I'm seeing nursing being there at the table of policy making in terms of health care, being there as in terms of leadership. And by the way, when you, especially in Kenya, I don't know about the other countries, when you go to the mid-level colleges, you'll find that most of the principals are really nurses. So really they are driving the leadership in terms of healthcare. So that's the future of nurses, where we are able to come together, interact with other multidisciplinary team members, and by the end of it, we really gear towards provision of that quality nursing care. So to finish in a summary, I'll only say that I've always said, and I tell my students and colleagues, that you cannot be a nurse if you are never called. I know Nightingale put nursing as a call, and it's really a call. We may not have had the voice, but really we cannot be nurses if we are never called, because what we do, very few can do it. Thank you.
Thank you so much, Bernard, for highlighting yourself as a lifelong learner. I think one of the greatest lessons we've learned from you is that we are encouraged to be lifelong learners, as you have done, and continue to make a great contribution to the profession of nursing and to improving and impacting care of our patients across the country. I think it is important, things that you have highlighted is engaging nursing in research, and making sure that we don't do research just for the sake of doing research, that the research that we are doing will contribute to evidence-based care, healthcare, and impacting and changing the way things do. I know in KNH, we have many students who are our alumni, and we hear great stories of how they have utilized research to actually change practice and inform practice in that very, very important national referral hospital. You've also highlighted the challenge of mentorship, and more so in advanced practice nursing, where we need to teach advanced clinical skills to our nurses and midwives. One of the ways we are leveraging that is by collaborating with medical doctors who work or teach primary healthcare physicians. And they have been really helpful in helping us start preparing a group, or the first group of pioneers who Bernard is part of, who can now take up mentorship and be involved in helping other universities start the program and start preparing a critical mass of expert clinicians who can work at primary level. So thank you so much, Bernard, for highlighting those and for also encouraging us to be lifelong learners. We move on to our next speaker. Our next student is Winnie Chepkurui. Winnie is brand new nurse. She's in her second year. And she is also she's had a bit of healthcare experience, not as a nurse or a health clinician, but within finance. She has worked within finance in the healthcare sector. And we would love to hear from you, Winnie. Over to you.
Thank you very
What's
much.
a favor and stick to the time. 5 minutes, please.
Okay, thank you very much. I'm happy to be part of this conversation, and I've been listening, and clearly I'm the youngest in the profession, and I've been inspired a lot from the stories that I've heard from my fellow students and from the professors. So for me, growing up, I've always had a passion for helping people. However, my journey into nursing was not straightforward. It has taken me over a decade to really realize that my purpose in life is to be a nurse. I've always watched the caregiving process from a sideline as a finance professional, but the nurses have really inspired me, and it's quite encouraging that to know that nurses encourage other people, even from other professions, to join the nursing profession. So for me, nursing means the human connections and compassion. It's about the small moments that you are able to be with the patient, to hold their hands, and when they are scared, and to advocate for their needs, especially when they cannot voice them. For me, it's about standing with the patients, especially during their vulnerable moments. In my previous place of work, our supervisor used to tell us that for you as a professional, as an healthcare professional, it's just a normal day at work. But for a patient, it's their most vulnerable moments. So as a nurse, I understand that for me, I could be going to work on a daily basis just to give my nursing my nursing services, but for the patient is the most vulnerable moment. As a nursing student, I'm very fortunate to learn in a world-class institution, and that emphasizes evidence-based practice and holistic care. Just like Bernard said, we have a well-equipped simulation lab, and the opportunity to practice my nursing skills on mannequins before I go to the clinical area is really important for me. Also, our clinical placements have really equipped me both technically, and it has also improved my critical thinking. The nurses at the hospitals where we go for the clinical placements have also been very supportive, and they offer guidance. And also the faculty that we have are very passionate. They listen to us, and they're able to give us guidance whenever we need it. One gap that I've realized is that for the nursing students, especially for us who are still very young in the profession, we have only done our first placement, is that there has to be more strengthening of mental health support and resilience training for the nursing students. The emotional toll of nursing can be overwhelming, especially when we undertook our first placement. And I think as a nursing student, I had underestimated the demands of the job. We need more conversations around how to care for ourselves as caregivers, and we can bridge this gap by integrating mental health programs and peer support into our curriculum. As I was reflecting on my nursing career, and at this point, I realized that what I need to do is to master the clinical skills, especially in my placement, and also to further coin the concepts that are needed for my career. My mentor is one of my lecturers in school. She is a medical surgical nursing lecturer, and the way she masters, the way she is able to integrate her knowledge and be able to think critically and quickly really inspires me to be a nurse just like her. And who are my support system? My greatest support system is the Aga Khan Hospital Kisumu, who is my sponsor for the nursing studies. I'm really grateful for that because I don't have to think about school fees, and that is really important for me. My other support system is my faculty advisor, my peers, and my family, and especially my 2 young children who in their voices, they think that their mother is studying to be a doctor. But I know one day they'll come to realize that their mother is going to be a great nurse in the future. The biggest challenge that we face in the current healthcare system, especially among the nursing students, is the high levels of stress that are due to the demanding academic programs and the clinical rotations. Mental health issues, as I've said earlier, is one great issue among nursing students that can lead to burnout, poor performance, and even attrition from the course. A solution that I could suggest is that the educators and the administrators can create mental health support systems to improve students' resilience and well-being. The other issue that we face as students and in the healthcare industry is funding that has already been mentioned, and I'm grateful to come from a university where scholarships have been awarded to students. I'm also a beneficiary of a scholarship, but I believe that there is still room for improvement, and the administrators can still explore other options for funding the nursing studies for students. The other challenge that we face in the healthcare industry is that there is limited access to quality healthcare services, especially in rural and underserved areas in Kenya. There is inadequate infrastructure, so shortage of healthcare professionals, and insufficient medical supplies. As a result, many Kenyans face difficulties accessing essential healthcare services. As a school and as nurses, as student nurses, we can participate in community-based outreach programs to deliver health, education, and basic medical services to the rural areas. For example, the administration can organize for students to be placed in the rural healthcare facilities where students will be exposed to realities of rural healthcare and encouraging them to serve in these areas after graduation. What is the future for nursing in my own perspective? The future for nursing is promising and dynamic, and this is shaped by the advancements in healthcare technology and an increasing focus on patient-centered care and a global demand for accessible quality healthcare. Nurses will play a critical role in addressing global health challenges such as aging populations, chronic diseases, mental health issues, and public health emergencies like the COVID-19 pandemic. In the coming years, nurses will likely move beyond traditional bedside care to take expanded roles as leaders, advocates, educators, and innovators in the healthcare systems. And how can nurses model global nursing? I believe that they can do this by embracing technology, by leading the adoption of new healthcare technologies, nurses can drive innovation in patient care, which includes exploring digital health solutions, data-driven decision-making, and evidence-based practices. They can also do this by championing global health equity, by addressing social determinants of health, and advocating for vulnerable populations. Leadership involves recognizing and tackling disparities in access to healthcare services. Thank you very much. That's all I had to say.
Thank you, Winnie. And to add what you have said, I think you have added to the voice of student nurses by talking about the issue of mental health and resilience for nursing students and for carers. And I think that is what we can add to what the voice of students has said this evening or this morning, depending on which part of the world you are. So we take it back to you, Perpetua. Thank you so much.
Thank you so much for all that you have shared. Special thanks to our professors for this evening, Dr. Eunice-Mugo, Dr. Phaladze, Dr. Mavis Mulaudzi, Dr. Isabel Combo. Thank you so much. And to our wonderful students, Mokwena, Nelson, Bulanle, Amadou Fie, Ria, Ituteng, Bernard, and Winnie. It's been wonderful hearing you all, and there's no doubt that the future of the profession on the African continent is great. You have showed that you are the future leaders, and once we get the settings right for you, the universe will be the limit, and therefore we are very grateful to you and all that you have shared. You have a great understanding of the health systems in which you are operating, and of course, an understanding of the global health agenda when it comes to the sustainable development goals, and of course, locally in terms of primary health care, how we can help the populations through universal health coverage, ensuring that there's no burden on people when they have to access care. The issues of increasing non-communicable diseases and all of that continues to be a great burden. And you have understanding of all of these. So it was great to hear your voices. And let me just chip in this, that even as you educate yourself within the many years of experience that some of you have, and the fact that some are just young in the profession and coming up, also be mindful of the global context in which you are learning to become nurses, or within your practice area, that the issues of climate change and environmental degradation, the issues of human migration, the changing demographics in terms of population change, the increasing inequities within societies, especially with health inequities, the geopolitics that plays out in terms of NATO, BRICS, and all of that, and our own local politics within our countries, the scientific and technological advancements all across the spectrum of our economies, and within health as well, the crisis that comes up and emergencies, all of these things has a great impact on our profession. And I just want to advise you to also keep on keeping an open mind and understanding the space in which because I believe you may not end up only in your countries to work. You may find yourselves in other places. So let's continue to be versatile in our learning and understanding of all that is happening within our various countries. So on this note, I want to say a very big thank you to Diva and Tess. And at this time, I'm going to hand over to them. I'm not too sure that I'm going to come back to speak. So thank you for the opportunity, and over to you, Diva and Tess, to take us through the next part of the agenda for this evening.
Thank you, Perpetual. Tess and I have agreed that I will just make brief closing remarks and then close with our traditional Nightingale Declaration. Just to say across all these 2 hours, it is always our challenge to consider how to encompass the profession of nursing, student nurses and their professors, how to encompass all of that in just a 2-hour session. And we've achieved this, you've achieved this. And thank you so much, Perpetual, and all of the students and professors involved. Now, Francesco, if we could close with the Nightingale Declaration for a Healthy World. And just to say, with regard to this, that we have a PowerPoint that features the English and the Kiswahili, knowing that Kiswahili is the official language of the African Union, and just to honor this particular nurses' voices from Africa with a Kiswahili text while I read the English. We, the nurses and concerned citizens of the global community, hereby dedicate ourselves to achieve a healthy world. We declare our willingness to unite in programs of action, to share information and solutions and improve health conditions for all humanity, locally, nationally, and globally. We further resolve to adopt personal practices and to implement public policies in our communities and nations, making this goal achievable and inevitable, beginning today in our own lives, in the life of our nations, and in the world at large. Florence Nightingale, what did she say to us? We are only on the threshold of nursing. In the future, which I will not see, for I am old, may a better way be opened. May we hope that when we are all dead and gone, leaders will arise who have been personally experienced in the hard, practical work, the difficulties and the joys of organizing nursing reforms, and who will lead far beyond anything we have done. Nightingale's dream is realized in each of you and in our work as we build a stronger nursing future together worldwide. Please join us with your voice. Thank you again. Thank you so much to all of you. Over to you, Francesco. Thank you for the extra time.
Of course, just to quickly wrap up, I would like to thank everybody for participating today. Thank you to all of the professors who joined us, and thank you to all of the students for sharing your stories. It was wonderful to hear all of the work that you're doing and all of the plans for the future. And thank you as well to everybody in the audience for joining us today. I hope that you've learned a lot, and I hope that you take away a lot of valuable lessons from today's session. With that, I would also just like to remind everybody that this is being recorded and will be up on our YouTube channel, which I have shared the link in the chat. And this is still an ongoing session. So our next session, session 4, will be featuring student nurses from the Western Pacific, and that will be held on February 11th at 7 p.m. Eastern Time. And that reminder will go out to everybody who is already registered a week before the session begins. And please feel free to keep sharing this series and the recordings and the registration with your networks and anyone who might be interested, as registration is always open and free. And with that, just like to give one last big thank you for everybody being here. Thank you for taking the time to join us. I know for some of you it's getting quite late. So thank you again, and I hope everybody has a great night, or a great rest of their day. Yeah, and with that, thank you so much, and we'll see everybody hopefully in a month.
Thank you, bye.